Welcome! In this session, we'll quickly cover adult drug calculations, starting with common unit conversions, then the basic dosage formula, and finally, IV flow rate and inotropic infusion calculations with simple examples. Conversions. First, conversions. These are the most common ones you'll use in medication calculations. 1 kilogram equals 1,000 grams. 1 gram equals 1,000 milligrams. And 1 milligram equals 1,000 micrograms. For volumes, remember, 1 teaspoon is 5 milliliters, 1 tablespoon is 15 milliliters, and 1 ounce is about 30 milliliters. You may also see older units like grains and drams. 1 grain is roughly 60 milligrams, and 1 dram is about 4 milliliters. 1,000 micrograms equals 1 milligram. 1,000 milligrams equals 1 gram. 1,000 grams equals 1 kilogram. 1 kilogram equals 2.2 pounds. 1 ounce equals 30 grams. Always pause on conversions, because most calculation errors start here. Formula for drug calculation. Now the core formula for tablet or medication dose calculation. Dose to administer equals desired dose divided by dose available, multiplied by quantity available. Example. A doctor has prescribed 250 milligrams of paracetamol. If the tablets available are 500 milligrams each, how many tablets should be given to deliver the prescribed dose? So, 250 divided by 500 is 0.5. Multiply by 1 tablet, and the answer is half a tablet. You can solve this using ratio proportion or the formula. Both give the same result. Parenteral medications, safe volumes. The same calculation logic applies to injectable medications, but you also must follow safe volume limits by route. For intradermal, the volume should be 0.1 milliliter or less. For subcutaneous, keep it 1 milliliter or less. For intramuscular injections, the safe volume depends on the patient. Healthy, well-developed adults can tolerate up to 3 milliliters in large muscles, except the deltoid. For elderly adults, thin individuals, or children, don't exceed 2 milliliters. And for young children or older infants, limit it to 1 milliliter or less. Calculating IV flow rate. Next, IV flow rate. If you're using a gravity set, the formula is flow rate in drops per minute equals volume to infuse times drop factor divided by time in minutes. And if you're calculating pump settings, use milliliters per hour equals total volume divided by time in hours. Example. A physician has ordered 500 milliliters of IV fluid to be infused over 4 hours. Using an IV set with a drop factor of 15 drops per milliliter, what is the required flow rate in drops per minute? First, multiply volume by drop factor. 500 times 15 equals 7,500 drops total. Now convert time to minutes. 4 hours times 60 equals 240 minutes. Finally, divide. 7,500 over 240 equals 31.25 drops per minute. In practice, you would run it at about 31 drops per minute, rounded to a whole drop. To calculate mLs per hour, now the pump style calculation. If the order is 1,000 milliliters of normal saline over 8 hours, milliliters per hour equals 1,000 divided by 8, which is 125 milliliters per hour. Inotropic infusion and drug calculation. Finally, inotropic infusions. These are often prescribed in micrograms per kilogram per minute, and then converted into milliliters per hour. Even if a pharmacist calculates it, the nurse should always verify the dose and the rate. The key relationship shown here is this formula is used to find the dose, micrograms per kilogram per minute, from the pump rate, milliliters per hour. Micrograms per kilogram per minute equals concentration multiplied by milliliters per hour divided by the patient's weight in kilograms and then divided by 60. This formula is used to find the pump rate, milliliters per hour, from the dose, micrograms per kilogram per minute. Milliliters per hour equals micrograms per kilogram per minute multiplied by the patient's weight in kilograms multiplied by 60, and then divided by the concentration. Milrinone example, milliliters an hour. Let's apply it. The patient weighs 60 kilograms and needs Milrinone at 8 micrograms per kilogram per minute. The concentration is 400 milligrams in 200 milliliters. Step 1. Convert concentration to micrograms per milliliter. 400 milligrams equals 400,000 micrograms. Divide by 200 milliliters, and you get 2,000 micrograms per milliliter. Step 2. Apply the formula. Milliliters per hour equals 8 times 60 times 60 divided by 2,000. That's 28,800 divided by 2,000, which equals 14.4 milliliters per hour. So the infusion rate is 14.4 milliliters per hour. You've now covered the core skills for adult drug calculation, from unit conversions and tablet volume dosing to IV infusions and inotropic pump rate calculations. Keep practicing these steps. Always double-check units, weight, and concentration, and verify your final answer before administering, because accurate calculations means safer patient care. For more practical clinical videos and learning content, visit www.healthcare-eskilling.com.